Healthcare systems around the world are facing increasing pressure due to staff shortages, limited resources, and growing patient demands. These challenges highlight the need for accessible and reliable digital healthcare support systems. To address this issue, our project proposes a conversational triage engine capable of analyzing user-provided demographic and symptom information to generate an appropriate healthcare recommendation. The system assigns a triage severity level between 1 and 6. This is achieved using a hybrid approach combining machine learning classification and rule-based clinical scoring. This is all delivered through a web-based interface. Moreover, to provide a medical backing to the outcomes generated by the system, it was trained on the Synapse dataset, which contains over 130,000 medically validated synthetic patient profiles.
This is the UI. The UI utilizes a font which is designed to reduce visual stress for users, especially those with dyslexia or reading difficulties, also featuring an accessible color scheme to assist users with visual impairments. The UI is specifically designed to be accessible for all individuals. Firstly, users enter their personal details, the biological sex of the user, and the numerical age of the user. A warning message appears if any required fields are left unanswered, ensuring all important information is collected for a more accurate assessment. Then, users provide the severity and duration of their symptoms. The length of time symptoms have been experienced is categorized as either less than 3 days or more than 3 days, and the severity is the user-reported overall symptom severity categorized as either mild, moderate, or severe. Users then enter their symptoms, one by one. Users are prevented from entering the same symptom twice with an error message to prevent duplicates. If a user forgets to enter a symptom or any other details, they can always go back as the progress is saved. They can also get rid of symptoms. After all symptoms are input, the UI provides the output of the triage recommendation. Included at the bottom is a disclaimer reminding users that this does not constitute as medical advice and to please consult a healthcare professional for any further medical concerns.
The machine learning classification used was a random forest model. For the model's final recommendation, the team also utilized the Northwestern Melbourne Primary Health Network's prioritization of patients triage guide to provide detailed triage recommendations. The triage guide consisted of a scale of prioritizing the severity of patients, with 1 being the most severe and 6 being the least. The final categories included 1. Call 000, 2. Go to the hospital and inform staff immediately. 3. Go to the hospital and join the triage queue. 4. See GP today. 5. Book GP appointment. And 6. Self-care/pharmacy. To calculate the final recommendation, the model takes the severity of symptoms into account along with a variety of modifiers, refining the final triage decision. The final triage score is defined as final score is equal to base symptom score plus age modifier plus duration modifier plus severity modifier plus illness cluster modifier plus de-escalation modifier. The illness cluster modifier reduces escalation when symptoms align with known common illness patterns like the flu or gastrointestinal presentations. This prevents overweighing or predictable symptom combinations. Finally, the de-escalation modifier acts as a stabilizing function that reduces score inflammation when 3 or more similar symptoms are input by the user. This modifier reduces the score of each symptom by 0.3 beyond the first 2 inputs. This serves as a safety measure in the case that a user inputs symptoms that are more likely to represent a single common illness. The developed system achieved strong overall performance with a high classification accuracy and effective symptom processing capabilities. The interface also improves the accessibility and usability for non-expert users. Overall, the project demonstrates the potential of AI-driven systems to improve access to reliable healthcare information, reduce unnecessary medical visits, and support the overburdened healthcare system worldwide.